Good morning. It's a great pleasure to be here and to be able to hear the discussion and the developments in the Philippines while the regional office is here in Manila. Sometimes we seem to be more involved in countries other than the Philippines, so I'm really delighted to be here. Now, universal health coverage is, of course, a goal and the aspiration that all countries have adopted. And so what I'd like to do is just to share some of the developments across the region in terms of how various countries are keeping the momentum. In his opening, Suman Kwan has already provided the definition, so I don't need to do that. But what I do emphasize is the way we look at the definition. Two elements we take very seriously. One is that full continuum from promotion through treatment to rehabilitation, palliation, so it's about a continuum. And secondly, it means we're interested in both the population level interventions as well as the individual care. And these two elements very much inform what we do. Now, of course, UHC is a critical target in Goal 3 of the Sustainable Development Goals. And we know that good health is very much related to economic and social development. It's very well interrelated in that good health contributes to economic and social development, and good economic and social development contributes to good health. So UHC is very much part of this much larger effort across government and across society. And how we build health system to contribute to UHC really means thinking about the critical levers and the role of government as a leader, providing the vision, providing the various tools available, but it's not government alone, and it's not the health sector alone. It does require working with other sectors. It requires community engagement. It is a whole of government and a whole of society approach. So it's really with that perspective in mind that in 2015, our regional committee adopted the action framework for universal health coverage in the region. And here what we start is really thinking about the health system attributes. These are what national health policies and plans usually state in various forms. Governments aspire to have health systems that provide quality service, that are efficiently run, that are equitable in access and in the outcomes, that there is a vision, there is an accountability, there is community participation, and it is sustainable and resilient. So these are the health system, perhaps performance outcomes that we are looking for. And we also know that across our countries, there are many shared challenges across all these different domains. The issue of infrastructure, gaps, facilities, supplies. We have many facilities still without running water, which is completely unacceptable for good health. We have absence of regulatory standards in many countries. We have insufficient engagement with patients and the community in a very provider-driven system. Many of our systems are hospital-dominated and not really sufficient investment in primary care, in public health functions. Our resource allocation often provide the wrong kind of incentives for the doctors and others in the system. Our management capacity is not what they need to be. And so we also see problems of financial protection, out-of-pocket payment. Philippines is no different in that respect, and the inequitable geographical and other forms of coverage, and certainly we see discrimination and exclusion in the health system. So we really need good leadership and coordination within the health sector at all different levels, but also across government. We need to see much stronger rule of law and better participation by the affected communities. We need to have information which is accessible by all, reliable, timely, and current, all of which really also means that we need to have a community that is engaged, able to take control of the factors that contribute to their health, and a health system that is well prepared for the future, that can deploy and redeploy its resources flexibly. So from these viewpoints, we have actually outlined action framework with 15 action domains, which countries can then put together in different ways to develop their own UHC roadmaps. And so we provide support for that. But we can effectively say, we can see the regions and the needs across countries divided into, perhaps it's a simple typology, but we have a range of different countries with shared concerns. So let me give you now a closer regional picture. Now this is an index, so we're actually just finishing our first baseline report on UHC and SDGs. So we're looking at financial protection and health service coverage index, and we can see that there's actually quite a lot of divergence across the region. And next week, this report will actually be considered further. But it gives us a sense of that spread across the countries. And when we look at out-of-pocket payments in relation to health service coverage, we can see also huge disparities. This gives us a few goals that we have to work on. But within countries, each country, by virtue of the UHC and the SDG agenda to leave no one behind and focus equity, we're obviously very concerned with percentage of population living below the poverty line, because that also says something about what we need to do by the way of financial protection. And when we think about Human Development Index, we need to look at the inequality and how that actually affects the Human Development Index. I won't go through these in detail, but just to illustrate that the inequality issues actually exist in all our countries, and more so in some than others. So the way we're proceeding on this is that we have set up what we call a TAG, a technical advisory group. This is quite often used by the WHO in a range of specific program areas to monitor achievements in immunization, in tuberculosis, and so on. And for the first time, we're really looking at UHC and how countries are progressing. And while we're thinking about the action domains and what we're trying to achieve in health systems, what we want to focus on is those key policy interventions of service delivery, health financing, and governance, and what actions could be taken. And the way we look at it in our tag is, at the end of the day, service delivery is how the community experiences the health system. We have to make that experience right. It's got to be quality, both from a technical viewpoint as well as from an experiential viewpoint. But financing is all about supporting good service delivery. The incentives have to be right, it has to be the right amount, it has to encourage the right kind of interventions, it has to encourage people going to the right sort of services. And the governance is about how to set that overall condition and enable the right service delivery experience, making sure that the financing is being used as a good tool. And of course, the other tool which is very useful for governments really don't have that many tools, is regulation. So this is the way that we're generally looking at how to move forward. Now, if I go to these 4 different countries, the typologies, let me give you some examples. We do have quite a number of high-income countries in the region where we have advanced systems, good social infrastructure, good financing mechanisms. But here, we still see challenges with groups that are excluded and equity problems. And last year, at our first UHC TAG meeting, these countries did suggest that equity was a major concern, an area of action for them. And particularly, the aging and NCD issue is one dimension, but also other socioeconomic health inequalities, different language groups, Aboriginal and other indigenous peoples, various ethnic groups. And what they required was actually a system change. They're looking at transformation of the service delivery model to a much more people-centered approach, But that has to be also traded off. I think these health systems are very concerned with how do you trade off cost, access, and quality. These three critical dimensions, they need to be balanced. And these countries are looking at technological possibilities of increasing access, and by introducing new technologies, disrupting old patterns of behavior on the part of the providers. And then using data, big data, to help drive the way we understand how people behave, how people seek care, and then strengthening the intersectoral action to act on social determinants of health. So the UHC, the SDG agendas are really brought together. Our transitional economies, China as an example, because it's in some ways exemplar, but also ahead of others. There have been, as we all know, very impressive economic growth, but with that came much bigger inequalities between the rich and the poor. The pendulum sort of swung from the left to the right, and we see huge problems in the hospital system, the demise of primary care, profit seeking by all, really, in the health system. And there were very many piecemeal reforms, but it was really when SARS hit that the government became quite serious in addressing the dysfunctions in the health system. And in 2009, there was a recognition that you need a whole of system reform. You can't do piecemeal. Everything has to be aligned, and that's been the basis. And interestingly enough, last August, the government, led by the president, adopted Healthy China 2030, aligned with the SDGs, and going beyond the health financing agenda to really looking at the social determinants of health, as well as a comprehensive development of the health industry. So we hope that these are examples that other transitional economies could look at. And this is some of the agenda that they have actually enunciated themselves, looking at the negative impact of rapid economic development and the consequences for health is one of these issues that these health systems are taking on. They're also taking on consideration about institutional change. How do they use the financing lever? How do they use the regulatory lever more effectively in a transition from a planned economy to a market economy? And how do they rebalance the hospital system and the private system? Take away the rent-seeking behavior in what we would call a system characterized by public identity and private behavior. And of course, there's a lot of system foundations necessary. Moving to our small Pacific Islands, I'll give you one example of Samoa, but it's not all that different from others. Inherited a colonial health system. There was brain drain, and therefore primary care really was in decline because all the resources were pulled into the hospital sector. With the high donor dependency, the government was adopting various policies as recommended by a multiplicity of donors. The NCD crisis hit, and the system was unprepared. There are hundreds of amputations being done unnecessarily in the health system. So then the question became, what do you do about prevention and early detection, especially if there's no longer really a primary healthcare system? So we supported a return to motivating the village women's committees to be engaged as the front line of NCD detection. Well, once the women were doing this, the nurses came out. And the government actually has now said, we have to rebuild the primary care system. And Cabinet has just decided to adopt a range of structural changes. So this is an example where the NCD crisis can lead to a rethink about how do you actually structure the system and how do you build all your policies around that. So our Pacific Islands They're not all like Samoa, but many are similar. So the issue of NCDs and climate change are top of their priorities in terms of the health challenges. And being able to really focus on good basic services is key. To do that at the different levels of the system and how all the resources are aligned around this frontline service delivery, ensuring the financing, the workforce, all aspects really come together. And of course, it also means the government has to strengthen its stewardship function, take control, and work with the development partners rather than be dominated by the development partners. So finally, Philippines is an example of a highly decentralized country. Now, it's not my role here to talk about the Philippines because you all know it better than I, but you might be surprised to hear that we would say, another country of great challenge in the same way is actually Papua New Guinea, because when you have highly decentralized countries, the institutional framework poses huge challenges in terms of how do you actually implement national policy. You can have beautiful policies, but the implementation is difficult. And Philippines, I know, it's a very complex country. Not just the institutional arrangements, but every aspect. And I think while Papua New Guinea might have 800 different languages across that country, Philippines follows a little bit behind. So appreciate the challenges that are there and the kind of inequalities. It might be mountains in the Philippines, but 7,000 islands is not easy to negotiate. So what we heard from our highly decentralized countries last year is the importance of systematizing, to move from a very fragmented system to really build something where there are clear rules, accountabilities, so everyone understands how a system works, even when you accommodate decentralization. And you really have to work on the coverage issues, developing the linkages between the different levels, making sure the financing is supporting how the system should work, and ensuring there is good oversight and supervision at all the different levels, both from a clinical quality viewpoint, as well as a regulatory implementation, as well as the overall performance of the system. So to integrate and align the different kinds of systems is a very critical issue, as is the health workforce. So that's a very quick run-through of the regional picture, the huge diversity that exists in what is, I think, the most dynamic region in the world. But in every single one of these examples, it's about taking a whole-of-system approach. And in that sense, we move beyond the health system building blocks, because the building blocks are the inputs, and they're important. But we have to make all these inputs come together and really perform and deliver on those attributes which really matter. I think the other issue that we can see across the countries is that health matters. It's not just about the financing. It's not just about the hospitals or primary care, but it's also about getting a good health outcome, an equitable and sustainable health outcome, which means that we have to really work on coherence. Coherence within the health sector, coherence across government, and of course, synergizing beyond government with community, with non-state actors. And so a whole-of-system approach means whole of government and whole of society. And together, we will achieve universal health coverage and the Sustainable Development Goals. Thank you very much. I wish you well.
Thank you, Dr. Lin, for your presentation. We now invite you to post your commitment on what could be your role to fast-track UHC.